my baseball players out there, what is the one name that you're really, really afraid of? Tommy John. UCL, ulnar collateral ligament, right here at the elbow. Anybody who pitches or throws a lot, even in football, but more likely in baseball. We're going into the All-Star break, and we have a lot of players that are going to be going into the stretch down the season. The wear and tear is going to increase here, and you're going to see more of these ruptures at this ligament here. Real quick, the assessment you want to have, the screening you want to have is something we provide here at PKL Physical Therapy. It is to make sure that the shoulder rotation is where it should be, and also your hips are in line the way they should be, and one's not tighter, causing the upward chain of stress on the shoulder and on the elbow. Many times people don't even look at the shoulder. It's very, very unfortunate, and it's surprising that the amount of players in the MLB are having this type of surgery. You would think that after a few research studies would indicate that shoulder lack of rotation internal compared to the external is a big indicator of the stress that's here and the predictor of the stress that's going to be put on this ligament here. And also the many studies that have been done that if your hip is limited in rotation on the either side or the opposite side, if I'm a lefty and I'm throwing, if my right hip is tighter or my left hip is tighter, if it's not as flexible as it should be, that stress starts going up into the upper quarter, goes at the shoulder, and if the shoulder's not equal to the range of motion internal to external, that puts more stress here, and that's why this ligament tears. The last reason, the last cause of why you tear this is here. It's here and it's here. Come in, we'll evaluate you, we'll screen you. Just literally had a patient today that came in, he's got stress here. I put my finger right on it, the kid jumped. It's because of the pain that he's having here is caused by here. I checked out his shoulder rotation, very limited in terms of internal. External, as you can imagine for a pitcher, is no problem. Internal is limited. That alone will cause a lot more pressure right here. His hips, we checked them out, the same side that he throws, he happens to be a lefty, his hip on his left side was very tight, and that would, again, equate to more force being put on this ligament. So if you are a pitcher, if you want to start a throwing program, and you want to make sure that you're not leading yourself down the road to have this Tommy John repair because of the rupture of this UCL, then come in and see us. PKLPT.com. You can call our Amityville office, 631-691-6900, or you call our Bethpage office, 516-605-1700. The greatest thing about all this is you do not need a prescription to start physical therapy. You can literally come here for 10 sessions or 30 days before you need to go see an orthopedist. We'll be happy to refer any of them that we know of and that we trust. But get yourself the care you need. You can literally call today and have your appointment in the next day or so. Come in and get the screening. Avoid this surgery. It is a very drastic surgery. I'm sure if you do any kind of YouTube searches for it, there's a lot, and the rehab process is a good year. There's no reason why this ligament should ever tear if you take care to make sure that the shoulder and the hips are the way that it's supposed to be in terms of flexibility, power, and range of motion. Give us a call. We'll get you assessed right away.